A decade ago, Leanne Elnicki had a really slow recovery after a challenging bike race.
Unfortunately, I was kind of gaslit, like I was looked at and said, oh, there's nothing wrong with you.
It's not until she had dental problems years later that she was diagnosed with Sjogren's disease.
About 1% of the population has Sjogren's disease, so in Canada, that's about 400,000 people.
It is an autoimmune disease, but we don't know what triggers it.
And it has a multitude of possible symptoms.
It starts off with the 4 hallmark symptoms of dry eyes, dry mouth, joint pain, and excessive fatigue.
But Dr. Leslie Lang says patients, who are mainly postmenopausal women, are often dismissed, leading to years of suffering before they are correctly diagnosed. Elnicki says dry mouth sounds minor to some people.
When you're not producing the same amount of saliva, your teeth aren't as protected against bacteria. So unfortunately, I'm 52 years old and I'm looking at getting dentures now because I've lost all of my molars. And it's embarrassing. It's really, it makes you self-conscious, as well as there are just foods that you can't enjoy anymore. A lot of times when you're missing teeth, the assumptions that people jump to are incredible. Like I've outright been accused of being a drug user.
And there's no treatment, just management of symptoms.
There are medications that people can take to help with joint and body pain. There are medications that people can take to help with dry eyes, dry mouth, etc. So in some cases, it means going to multiple specialists.
And there are serious long-term implications.
It affects the lungs, it affects the heart, there are cardiac issues, obviously with dry mouth, it's trouble with swallowing food, so the gastrointestinal features, liver features, and there's a greater chance of getting lymphoma and cancers.
Elnicki says people experiencing symptoms need to push for a proper diagnosis because awareness of Sjogren's disease is low, even in the medical community. Pauline Chan, CTV News.